Great, welcome to the AMREP Honours in Graduate Research Information Evening. It's great to see so many of you. So AMREP there's two Monash schools, so the Central Clinical School. I'm from the School of Public Health and Preventive Medicine, and there's also the Burnett Centre and the Baker IDI. So within like a kilometre or two of here, something like, I think it's like 10% of the NHMRC budget is spent, and it's really quite diverse research from populations to mice and cellular processes. So if you're interested in medical research, you've come to the right place, and there'll be something for pretty much everyone here. Just going to, oops. Okay, so in this part of the session, I'm going to. This is mainly focused on public health, and I've got Stelliana and Joe also talking. So Stelliana's a current honours student doing honours at the Burnett Centre, and Joe's one of the honours coordinators at the School of Public Health. And then later, there's Stephen Jane from the Central Clinical School speaking as well. So what we focus on is, at the whole precinct, is really translational research. So this is taking things from basic research, from understanding of cellular processes and mice and epidemiology, to answering some of the big questions and making a difference for patients and populations. So we have the School of Public Health, as I mentioned, and this encompasses everything from clinical trials and public health research right out to quite specialty clinical areas. The Baker IDI focuses on cardiology and diabetes, the Burnett Centre on global health and infectious diseases. The Central Clinical School has a lot of the clinical departments of the hospital, allergy, anaesthesia, haematology, infectious diseases as well. And a lot of these involve clinician scientists, so doctors who also work as scientists and also scientists who specialise in science. And so having proximity to patients and clinical samples is an asset to research. So there'll be a number of us outside in different rooms, and if you want to do honours with us at the School of Public Health, then Joe and I are the people to talk to. At immunology at AMREP, there's Justin Hamilton and Margaret Gibbs, and Justin also with other departments of the Central Clinical School. So why might you want to come here specifically? So even though, as I mentioned before, there's quite a lot of research going on, but there's also quite a lot around in Prahran and just down the road from Chapel Street and all of the lake. And if you compare that to what happens at Clayton, it's a little bit more attractive. At the School of Public Health, we answer a lot of clinical questions. So in my area of infectious diseases, we look at control effort against Ebola. Manoj Gambhir is a mathematician and physicist who has modelled the spread of Ebola. We have a program focused on patient safety, about preventing mistakes in hospital. The critical care area is a very large area that does a lot of clinical trials, and one of their recent clinical trials was about how to prevent severe head injuries, or best treat severe head injuries to prevent long-term brain damage. There's a number of women's health programs at the School of Public Health. The Environmental Health and Occupational Health Department has been contracted by the state government to look at the outcomes after the Hazelwood fire and the patients that were exposed there. We have the Victorian Institute for Forensic Medicine, do a lot of DNA tracking, and they hate it when we talk about CSI, but that's what they do. And then we have an environmental health program that is looking at mobile phones and the impact on that on children. We have three streams of honours students. We have Bachelor of Medical Science, the medical students, the Bachelor of Biomedical Science honours program, the Bachelor of Health Science honours program, and there's about 30 to 40 students within that. There are a lot of other students as well. There's over 170 students that are studying towards their PhD at the School of Public Health. Some of them engaged with some of the affiliated institutes at the Baker and the Burnett. So why might you want to do honours with the School of Public Health specifically? So we do research that involves people, and this is research that actually has an impact on people and populations. We have a lot of departments with specialties in epidemiology and statistics, which is really a lot of the basics of research, and a lot of the projects are already established, and so it's a matter of getting data and analysing data from that, rather than, at least with some projects, you don't have to go out and collect it yourself. It's a very supportive environment with all the PhD students and other programs. There are seminar series and training programs and so on. And our students contribute to the medical literature, so from just looking at last year's publications, there were 11 publications from students, and some of them are in quite high impact journals. So probably the best example is a student from a few years ago that published her study in the Annals of Internal Medicine, one of the sort of the highly ranked journals in the field. And these are really some findings from research programs recently, and some of the major findings from them, all of them published in the literature. So really there's really a very diverse range of projects. It's really quite a unique experience. There's sort of there's the clinical world and then the world where the research takes place, and you really get to interact between them, and there's really a lot of opportunities for different career paths from that. It's a really rewarding year where you learn a lot of things, and it's, I think we say it's sort of a gateway to lots of different careers and study options in the future.